All right, let's talk about the renal blood flow autoregulation. What is an autoregulation? We have an autoregulatory mechanism help maintain the constant renal blood flow and the GFR to protect the kidney from rapid increase, decrease in renal perfusion pressure that could cause renal injury or decrease in GFR. How do we have? We have two things here. We have the myogenic and we have the tubuloglomerular. So in myogenic, how do we autoregulate in myogenic? Well, in myogenic, what we have is we have an increase. If we have an increase in arterial pressure that causes stretch of afferent arterioles. So we increase the arterial pressure, causes stretch of afferent arterioles. This leads to mechanical activation of vascular smooth muscles, which causes vasoconstriction of the afferent arterioles, which leads to decrease in blood flow. Okay. Decrease in blood flow. So what is the end result in myogenic? Decrease in blood flow. What is the end result in tubuloglomerular autoregulation? Decrease in blood flow, but the mechanism is different. Let's read the tubuloglomerular. We have increase in sodium chloride or tonicity of the filtrate sensed by. Increased sodium chloride is sensed by macula densa cells, which leads to paracrine-driven vasoconstriction of afferent arterioles. So if the afferents are vasoconstricted, you have decreased amount of sodium chloride going into the macula densa and also going into the glomerular, right? Okay, but here let's just talk about this one more. So when you decrease the arterial pressure, when you, my bad, it says increase. When the pressure is increased, the afferent arterioles stretch. There's a stretch in the afferent arterioles, which causes mechanical activation of the vascular smooth muscle. So that leads to vasoconstriction. So stretch eventually causes vasoconstriction of the afferent arterioles. When you decrease the amount of blood going into the kidney through the afferent arterioles, you're decreasing the renal blood flow. Right? So that's it in both myogenic and tubulo. Myogenic is about constriction due to the stretch because of the increase in arterial pressure, and why the tubuloglomerular is due to the fact that you have the increase in sodium chloride, which is again sensed by macula densa, and that causes constriction of the afferent arterioles. But the end result, both are decreasing the renal blood flow, because this is renal blood flow autoregulation through myogenic and tubuloglomerular pathways.